Okay, this is the continuation of our lecture from last week on Chapter 6. We didn't quite finish it, so I wanted to go back over some of the information starting on slide 35. Your book describes the different phases in your chapters on the three phases of caring for the infant. The first phase, of course, is birth to that first hour. This is typically in the delivery room or the labor room where mom has delivered. And of course, again, depending on the facility and how they're set up, will depend on how long mom and baby stay in the labor and delivery area. With phase 1, your focus is primarily on maintaining thermoregulation, maintaining cardiopulmonary status, observing for voiding and stooling, making sure before baby and mom are separated, if separated, that proper identification and security bands are placed on the child and on parents, a brief assessment, and then of course encouraging bonding, breast or bottle feeding is also initiated during this time. So why is it important to maintain thermoregulation? It is important because with heat loss, when heat loss can be kept at a minimum, there is less oxygen or less need for oxygen. Okay, I mean they need oxygen. Okay, so don't misunderstand me. They still need that, but they don't consume as much if their temperature is maintained. Okay, a low temperature can lead to hypothermia. Hypothermia can lead to hypoglycemia. And of course, then because the baby is consuming and using a lot of energy that he or she doesn't need to use, they're going to be using up more glucose and to try to get their body temperature to increase. They don't shiver like you and I do. Okay? With low blood sugar, if this is not prevented or not corrected, this can lead to neurological problems. So hypothermia can also cause cold stress. Because the thermoregulatory center of the brain is not completely functioning, with cold stress there is an increase of the metabolic rate and oxygen consumption. So bottom line, baby's using up a lot of energy just to stay warm. It's not necessary. Okay? If we're doing our job and keeping that baby warm, keeping those glucoses up, they would not need to consume as much. Okay? After a while, the baby is not going to be able to keep up these demands. Okay? He's breathing harder, he's working harder, and eventually he's going to tire out, and it's going to lead to respiratory distress and hypoxia. So, again, ways that we can prevent this is drying them off immediately, placing them in the warmer, placing a hat, wrapping them, skin-to-skin contact. All the above is very, very important that we do that. Okay? Phase 2 gets into more of the first couple of hours, 1 to 3 hours. Again, this can be done in the delivery area where medications are given, measurements are completed, length and weight and head circumference and chest circumference. Another assessment, if it's a new nurse taking over, continuing to monitor the vital signs, is during that phase 2. And then phase 3 is at from roughly 2 to 12 hours. And again, usually this is done in the postpartum room with the mom. It may be done in a nursery if need be, but that's where it's typically done. So we've already mentioned all this here. One thing, with urination and passage of stool, the first stool is called meconium. It is very important that as a nurse you identify or note when this is done because, baby is sent home and no one knows if they've pooped or peed. That can be detrimental if they have not. So again, really focusing in on your assessment and identifying any issues or concerns you may have. So if you've already gone through my clinical, you've worked through the little case study scenario on Apgar scoring. If you do not remember it, you can go back and review newborn vital signs, D2L assignment. Also, your book talks about Apgar scoring. It does rate, heart rate, respiratory, muscle tone, reflex response, such as suctioning, grasp, rooting, all those, and skin color. Remember that the Apgar score, it's timed, or it's scored at 1 minute of life and at 5 minutes. Each section, like the heart rate, respirations, etc., or is scored on a 0 to 2 scale, 2 being that heart rate is between 110 to 160, right on. Respiratory, 0 to 2. A 2 would be if the respirations are between normal limits, 40 to 60. I know ATI or some references allude to it being 30 to 60. Again, you got to know your scoring and how to score this. Okay, it is not a predictor. It is not a predictor for intelligence. It just gives us a picture at that 1 minute and 5 minutes of how that baby is transitioning into the world. Also on that D2L assignment on newborn vital signs, there's some great information about respiratory distress. You need to understand what respiratory distress and the signs and symptoms. Grunting, nasal flaring, cyanosis, and I'm not talking just the hands and feet. When it's just blue hands and feet, it's called acrocyanosis, okay? And that's not unusual right after delivery. But cyanosis, generalized cyanosis, retractions, increased respirations or decreased respirations, increased heart rate or decreased heart rate. Here is a little Apgar score scale. I believe there is also one in your book on page 152 that you do need to, again, know this, okay, and review it. Also on page 153 and 154, it goes through administration of eye ointment and IM injections. The 2 required medications at birth is erythromycin eye ointment. This is to prevent ophthalmia neonatorum, which can be caused by either gonorrhea or chlamydia. The American Academy of Pediatrics Association also recommends to treat this, so it's not just a requirement, but it is highly recommended by the American Academy of Pediatrics. Vitamin K, or aquamaphytin, is given to assist with blood clotting. It is naturally produced in the intestine, but it is absent in the newborn. Okay, so a single dose is given in the vastus lateralis before the infant leaves delivery room. This is very important. And then I believe I've already mentioned about umbilical cord, cord blood banking. You may want to just review over this. Again, this is something that is not done spur of the moment. This is planned, and permits have to be signed. Everybody has to be on board with this, and the hospital has to know how to be how to care for this situation. So this is the end of Chapter 6. I will start another recording for Chapter 8. We will be covering Chapter 8 on Thursday, but I wanted to get a head start. Also on discussing the Phase 2 care of the newborn, so that you're ready to go Thursday morning, and we also will have some time to review for the test next week. Okie doke. Thank you.